Yeah, they do have evenings, but yeah.
I've been seeing these smudges on these faces all day. I was at the airport, I keep seeing smudges.
I just saw a couple of people today.
You're my dream. I was alone in my shop all day. Yeah, I know. I know it's silly, but what is this circle thing on the back of the phone?
Oh, that's my magnet that holds it onto the thing in my car.
So I even have one. I don't even know what it's for.
It just goes, it holds it onto the car when you go.
Onto the car.
Even when you go over big bumps and everything.
It holds the phone.
It does.
It's a magnet.
Like, is it that really? Never tested it out.
Okay.
Yeah. Oh, I should make sure.
Are we recording?
We are recording.
Okay, well, welcome. Welcome to the East Richmond Heights Municipal Advisory Council. Thank you guys for being here. It is freezing in this room, but we're all warmly dressed. Okay, so first call to order. Roll call: Victoria Curtis, Vice Chair. Member Jim Way. Don't see Jim Way. Joanne.
Here.
Pam.
Here.
Laura.
Here.
Okay, I am here. All right. Don't have any introductions this time. So let's go to Treasurer's Report, Ronnie.
Yes. Let me get my bearings here. All right.
You're reading at the new podium.
Yeah.
We're at $2,137.21, and everything is up to date.
Okay. All right. Thank you.
Yes.
All right. We have the minutes of the January 21st meeting. Is there any discussion? I saw the one thing that I noticed was that I think we need to name for presentation 5. Michelle was there, but it was actually Chief Bachman who was here too, and we need to have his name in there, but I didn't see anything else.
Yeah, I have an addition, under the land use committee. The minutes only reflect that we reviewed one project, but we actually reviewed 2 projects at that meeting on January 13th. And the second one is 6803 Del Monte Avenue. And it was basically for repair of a deck with no enlargement whatsoever. So it was just recommended for approval for the variance of the small lot design.
Okay, so
I remember that.
we're adding that to the minutes. Joanna,
Yes.
if you turn that on, they will not be able to hear us
Okay.
because of the noise it makes.
Well, I'm not having no success turning it on, so.
Oh, okay, all right, just to let you know, because we've had it on,
Okay, all right.
it blocks out the Zoom.
All right.
Okay, so with those amendments to the minutes, anything else, anybody notice? All right, let's do a motion to approve.
Motion to approve.
Okay,
second that.
and a second, Victoria. All right, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. The minutes are approved. All right, first presentation is Pottstown County Supervisor John Joya. I see John with us tonight.
Hi, so I thought I would give the report tonight. I was up in that room last night. It was warm up in that room last night, all I can say. And it was good pancakes. I got to see a couple of the MAC members up there last night. So let me just give a few items that are relevant in the report. 2 are about giving money out, and 1 is about taking money. So taking money for a good cause. So you've probably seen our announcement that went out announcing a grant program for a community impact grant program of $1 million. The county had received during the pandemic some federal funding, and we had $5 million from that the board allocated to the general fund and $1 million per supervisorial district for grant programs. We allocated some other funding to various important needs around the county, including food security. And the grant program, which we announced at the end of January, are grants for up to $50,000 to address economic and health disparities and achieve equity in communities in West County, in my district, which of course includes East Richmond Heights. And so the application period is open on that through the end of February. And you can contact in our email announcement and on our website is all the information about this in the application. And we are accepting applications through the end of, as I say, the end of the month. Second, you probably saw an announcement that was from the Air District. I serve on the Bay Area Air District, and I advocated for a policy change where most of the money that the Air District collects on fines and penalties be spent in the community where the funds were received or where the harm occurred. And the Air District announced a program in Benicia and one in West Contra Costa, which in this case includes East Richmond as well. It's about $36 million in settlement monies and fines and penalties collected from Chevron for the purpose of improving health, economic development as part of transition away from fossil fuels, things like that. And we did send an announcement on that. And it links to the Air District's information and application process. And those applications go through the end of May. And those are larger grants, and a lot of community-based organizations are looking at things like that are broad-based on health. Some of them could include. I don't know what's been applied for because the process just started, but I just wanted to announce that.
And John, that
Yeah.
was 36 million from the two, Benicia and,
36 million for the Richmond area, meaning Richmond,
okay,
Pablo, North Richmond, surrounding unincorporated areas like East Richmond Heights, Rollingwood, Montalvan Manor, Terry Hills, a small part of El Sobrante. So that is the not El Cerrito, as I recall, because you're sort of in the impacted area. Third, for those of you especially focused on land use and planning issues, the Board of Supervisors has placed on the June ballot the extension of the urban limit line, which is set to expire at the end of this year. I'm the last remaining supervisor that was around when we put the last line on the ballot in, I think it was 2006. And so it's up for renewal. It was valid for 20 years and really doesn't impact East Richmond. The line has not changed. The areas outside the urban limit line that are in El Sobrante, for example, remain outside the line. They haven't changed. Fourth, as you know, a number of federal policies, including H.R. 1, changed funding for Medicaid, Medi-Cal, food programs, things like that, and eligibility requirements and documentation. And the impact on large health systems like ours at the county will be significant. It could be $300 million over 4 years. We run, as you know, a major regional hospital in Martinez and 11 health clinics. 2 of them are in West County. We also provide medical care directly to 260,000 Contra Costa residents who are Medi-Cal residents who are Medi-Cal eligible. By comparison, the other Medi-Cal provider in Contra Costa is Kaiser, and they provide care to about 50,000 Medi-Cal patients. So a little over 300,000 residents in this county out of 1.1 million are in Medi-Cal. The estimate could be 50 to 90,000 people could lose health care, which would mean that more people would go to the emergency room. And that, of course, means they will get sicker, delay their care, longer longer wait times at the emergency room, possibly longer ambulance transport times because more people using ERs, increased cost to the health system, potentially people losing their eligibility for food assistance. So very significant impacts. Fixed income seniors are some of the hardest hit. So the Board of Supervisors unanimously, in a bipartisan way, both the Republican member and our Democratic members, have placed a 5-year temporary sales tax on the June ballot. We'll take a final vote on that on March 3rd. It would be a 5/8 cent sales tax in all of Contra Costa County, meaning in the cities and unincorporated areas, that would raise about $150 million a year for 5 years. What we're doing is we're looking at making our own cuts and, continuing to make the health department more efficient. And some of these are cuts that will be made. We will continue to advocate for changing these federal policies. And then we're doing what Santa Clara County did and what Los Angeles County is also putting on the ballot. Santa Clara passed a similar 5-year, 5/8 cent sales tax last November. Los Angeles is also putting one on the ballot. These are counties with large health systems. John Muir and Kaiser's health systems are concerned. They serve Medi-Cal. They also know that people who lose health care also means more demand on their facilities and their emergency rooms. So that will be on the June ballot. How much does it cost to increase the sales tax by 5/8? For an average Contra Costan making median income in Contra Costa, the estimate is that would run about $10 a month in extra sales taxes. For a fixed income senior who makes a lot less than median income and also spends a lot less, it could be under $5 a month more. However, people who are impacted, like fixed income seniors, could end up paying hundreds of dollars a month more if they lost food assistance or have to be forced to pay for medical care. So in a sense, it is an investment, especially in lower income, fixed income residents who could lose their health care and impact all of us by going to the emergency room, becoming sicker, and affecting our population health in Contra Costa. So I strongly support this. We believe it's an investment for 5 years as we work long term on reversing some of the policies. This affects Medicaid eligible patients across the United States. California's hard hit. And as you know, we call it Medi-Cal. And one of the things we're looking at doing is hiring more eligibility workers to be able to keep people enrolled. The way some of these requirements work, you have to re-enroll now every 6 months in Medi-Cal as opposed to every year. And some people who lose eligibility will not be able to re-enroll. So we want to keep people enrolled because the federal and state government covers their health care. If they lose health coverage, they're eligible for the county's basic health care, which is funded by our property tax dollars and is not as vibrant, is not as robust as Medi-Cal. So we end up in our general fund having to pick up the cost to provide some medical care to people as well. So that's why we believe it's a good investment for 5 years. So I just wanted to talk about those four items. And opening up. And the other item you may hear from fire is our fire chief, Louis Burchard, will be retiring soon. Chief Burchard has done a great job as our chief for the last number of years, and we'll be looking to appoint an interim while we do a search that would include the interim or anybody else that applies. So I'll stop there. There's probably more I could cover, but those are the highlights.
So Victoria and then.
I'm gonna just ask you a question. Every time I read about all the penalties against Chevron and all this money that they put out, I get nervous because I know that Chevron is one of the biggest money makers in our city, right? Is that the one that pays the most taxes?
To the city of Richmond, yeah. So Chevron is the largest property tax payer in the county, and I'll get to Richmond in a second, but we have a very diverse property tax base. So their property tax payment, while it's the largest, we are a large county, very diverse economy, and a lot. So we're pretty well balanced. Richmond's another story. In Richmond gets a share of their property taxes. It also gets a utility tax and some other taxes they collect. I don't remember whether it's a quarter or 30% of their revenue, but it's a lot. It's not that with the county. We have a $7 billion budget. Richmond's more like, I don't know if it's under 300 million, 200 million. So this fine and penalty, um, 36 million, 20 million was in a settlement with Chevron after they withdrew a lawsuit challenging a regulation to reduce emissions. And then the other 16 million were some fines and penalties that they agreed to. Let me just say, Chevron is a huge corporation. I will pull up and Chevron's revenues are in 2025 are about $190 billion. Their fourth quarter revenue was about $47 billion. So, the $36 million is for pollution violations or other violations. So I think in the full context of things, 36 million is not going to be a factor in a decision whether they close or not, and of one-time money. They do earn revenue off the refinery sales of gasoline. They actually, I think they just entered into an agreement with Richmond to pay $60 million more per year in taxes. So that's over $500 million over 10 years. That is a much larger increase in their taxes than their one-time $36 million payment to the Air District for fines and penalties and settlements.
Okay, so you don't think there's any likelihood they pull out and just move somewhere else?
Not because of the $36 million. I think, the Benicia refinery, Valero announced its closure. There were four refineries in Contra Costa. As you know, two of them made the decision to convert from processing or refining crude oil to refining renewable. They manufacture renewable diesel using soybean oil, animal fats, things like that. That's the Phillips refinery in Rodeo and the Marathon refinery in Martinez. That leaves the Martinez refinery and Chevron is the two that refine crude oil, and in Benicia, Valero. Now, it is true, as refineries convert to renewables or close, and there was a refinery in Los Angeles that also closed, and one in Benicia, it does mean less supply of gasoline There's also the trend of less demand for gasoline as cars become more efficient, fuel efficient, and there's more electric cars. I think 20% of new car sales in California last year were electric. And then, of course, greater fuel efficiency. So the projection is a continued decreased demand for gasoline, although there is concern that as refineries announce closures or transitions, that could have an impact on the price of gasoline. I think that's the larger issue. I mean, realistically, I don't see Chevron closing anytime soon. They are a very diverse refinery that also manufactures lube oils. You know, there in the Bay Area after Valero closes, there will only be two instead of five refineries that make gasoline um, out of crude. So I think, you know, the issue is what does that mean in terms of supply and demand and pricing? And many things impact the price of gas. For example, you know, a lot of it's the market price of crude oil, um, demand for gasoline, or if a refinery has to close for maintenance or has an accident like one that happened in LA and there's less supply on the market, that can also impact the price. So I think that's the larger issue is what's the price of gas. I think Chevron is a pretty solid company, and I don't think one time $36 million in fines, penalties, and settlements is going to cause them to close. The decision to pay Richmond $500 million more over 10 years hasn't factored into that. They are investing a few $100 million to put equipment in their refinery um, to comply with a new air district regulation that they had challenged and they dropped their lawsuit, which will reduce particulate matter from the refinery by like 60%. So they're making a decision to invest a few $100 million to put equipment to make their refinery cleaner. So that to me is an indication that they're continuing to invest to keep their refinery operating.
Thank you, I appreciate that.
Okay, Joanne?
Yeah, I have a couple of questions. The first is, have you received many applications for the $1 million grants? The second is there any anticipated opposition to renewing the urban limit line? And finally, I'm just talking about the new 5/8 cent tax. I was curious what's happening with the hospital or the medical center that was proposed in Emeryville, I believe.
All good questions. So we received 19 applications so far as of today on that. I don't know if they're all at 50,000, some may be less, but we've received, if we were to provide 50,000 to each grant, that would be 20 grants. Some of them could be less. So, but we've received 19 applications. Your second question, there's been no opposition we've heard on the urban limit line. So hopefully none will exist. And so hopefully that goes through. On the 5/8 cent, um, uh, so Sutter, there is this deadline of seismic compliance for hospitals by 2030. And hold on one second. Hold on. Sorry. So Sutter was needing to comply with seismic regulations at a pretty expensive price tag for the Alta Bates. And they had announced a while back that they were going to close Alta Bates and then add on to their Summit Hospital in downtown Oakland and to replace the lost emergency rooms at Alta Bates with emergency rooms in downtown Oakland. They then changed course and decided they were going to, after Alta Bates was closed, move forward with building a new hospital off of on Powell Street off of Interstate 80 that would have both regular inpatient beds and emergency room beds. I think an equal or greater number than what was at Alta Bates. And we're going to convert our Alta Bates into another type of facility. Um, So the good news in that is it actually generally it looks like it could slightly decrease the ambulance travel time from West County to their hospital in Berkeley. That it takes slightly less to go down, depending on traffic, on Interstate 80 and then getting off at Powell and going to a hospital that's literally right off the freeway than it is to get off at Ashby and then go all the way up Ashby, pretty much to, almost to College Avenue. So it actually slightly decreases the travel time um, for when the new hospital is built. Clearly, still a shortage of hospital of ER capacity in West County. Kaiser increased their capacity after the closure of doctors. We've been in conversations with other health systems. I've talked to the leadership at John Muir, which has a hospital in Walnut Creek and in Concord. We'd love to work with them to build a hospital somewhere on the west side of the hills. They're not prepared to invest $1 billion or $2 billion, what it would take to build a new hospital at this time. So, I mean, realistically, there's not really an opportunity, as much as people may want to promise this to the community, there's no entity out there that has $1 billion or more to spend to build a new hospital and operate it. Kaiser may expand. That would be great. I mean, they had one time had considered expanding Kaiser Richmond, but I don't see on the horizon a new hospital anytime soon. In fact, the models are hospitals. There's less hospitals, right? Because there's more outpatient procedures, but we have a shortage of emergency rooms, no doubt.
When do they anticipate the Emeryville one to be completed?
I saw an estimate that was around 2032 or 2033, which would mean they probably would get ability to keep Alta Bates open until that time. And then they would transition from Alta Bates to this new hospital, which, I think for in West County, it's again, it's better having the emergency room beds right off the freeway than having it up in the, up Ashby.
Joanne, what did that?
Pardon?
Is that all?
That's it.
Okay, all right. Anybody else have any questions for Supervisor Joy?
I see a question in the chat about the view ordinance update. Well, I actually talked about that yesterday at the GRIP event at the church with Bara and Joanne. Um, and I mentioned the county staff is looking at reviewing and making a few changes to the Kensington ordinance. So I think, before we adopt anything new in East Richmond, because I think with our 20-year experience, there's some things that have come up. So we're going to look at that and maybe have a conversation with East Richmond. So I think the feeling is that it should be the same ordinance, similar issues. They don't want two communities of 5,000 people each having their own ordinances. It's the only place in the county that has this ordinance. So I think they're looking at, and I'm going to engage the planning department about what those changes could be, and we could talk to the MAC about that and then look at how that could be incorporated in East Richmond.
I agree. I think they're very similar communities, so.
Yeah.
They
They want to make them, I think they're going to suggest some changes to the Kensington ordinance. So, I think that would be timely as we look at what to do here.
What's the timing on all of this?
Wow, with everything happening, we'll have to check in. I know, hopefully, I'll engage to see if we can get them going on this in the next couple months.
Okay, any other questions for Supervisor Joya?
Just a quick comment. My doctor's office in on locally here, right off of what is it? Right off of San Pablo, which is a John Muir facility, just closed.
Yeah.
So now I have to go to Berkeley.
Right.
There just doesn't seem to be any
Yeah.
doctors around here.
I talked to them about that. Yeah, we expressed some concern. You know, there, as you know, there's a large practice out in Pinole and in San Pablo that's actually owned by Stanford Hospital. Stanford owns that practice. It used to be locally owned. It's now owned by Stanford. And of course, so yeah, I don't, they, I think all health systems are having stresses, and John Muir included. And yeah, they closed that their facility here and sending the patients to Berkeley. Um, there, I don't know, depending what health plan you have, there are physicians in Pinole and San Pablo. There's some offices. There's a few others that are scattered, but the larger practices are there. And yeah, that is a challenge and a problem. And there are less doctors around than there used to be here. Many of them have made decisions to move into Berkeley. As I say, I think the largest groups are out in Pinole. Yeah, I, that was, yeah, part of their decision making, on operations.
Yeah, John,
What's the
but
name of the one in Pinole, by the way?
The one in Pinole is Stanford. Used to be, I forgot the name because I used to go to that before I switched back to Kaiser. I used to go to that and had a doctor in Pinole. And they also own they own I think a small office in San Pablo as well. But it's Stanford Healthcare.
Okay, thank you.
yeah,
And they could be eligible, you should check your health plan to see if they're included. The Stanford Health Plan is doctors is in your group.
Yeah, Medicare. Yeah.
Yeah.
Greg, it's up on the corner up by Appian Way, up there near where the
Yes.
McDonald's is.
Yeah.
Yeah,
And
that's where that large, yeah, that's a
but
Stanford Healthcare.
I want to mention that my doctor is Stanford and San Pablo, and they just closed that building.
Wow.
Is that
So
the one on San Pablo Avenue in the Dam Road?
yes, and
Yeah.
they've closed that, and my doctor's now with Pinole, so I have
Yeah.
to go.
Well, that facility in San Pablo originally opened with some support from the old doctor's hospital. And it was physicians who worked with Doctors Hospital. I remember when that opened. Yeah, I think I'd heard something about that possible closure. So they moved those physicians, probably more cost, economies of scale to their office in Pinole, right? Same practice. It's
Yes,
there is a Stanford Healthcare Lab in Emeryville, as you know. They have a number of facilities in Emeryville. But I think that used to be Dr. Richard Sankary, and I forgot whether it was Alliance Medical Group, but they were bought out by Stanford.
yeah, it was
I know
Alliance.
I know that Kaiser long term is looking at additional clinics in West County. I think they see growth. They built something new in Berkeley. Of course, they have their relatively new facility in Pinole as well. I think it is likelier that they may expand. Kaiser is the largest commercial healthcare provider in West County. You have the county and Kaiser. Um, and then the Stanford Medical Group is much smaller. So that's one of the issues why Sutter, John Muir, and others don't always come into this market. Has over a majority of the commercial market in West Contra Costa County.
John, I have Medicare now and Sutter, but what percentage of West County uses Kaiser?
I
And are
can
we, if
well,
not a
I
Kaiser, can I go to
yeah,
emergency there?
I can tell you that about half of the patients at the emergency room are not Kaiser patients.
But they will accommodate.
So, oh yeah, they under the law have to take people who are taken there. Some are uninsured, some are insured with other plans. So if you have a 911 call, you get to tell the ambulance where you want to go. Like if you're a Sutter patient and they can, and they can take the time to take you to Berkeley, they will. Um, but also sometimes you need to go to the closest hospital. and they will take you to Kaiser, and then you go to Kaiser, and then eventually you may be transferred after you're stabilized. But they can't turn you away because you're not Kaiser. But half of their ER patients, as I said, are not Kaiser now. For regular hospitalizations, you have to be a Kaiser patient. And I don't know. I knew the numbers at one time were a majority of the commercial market. Again, taking aside, I think the Medi-Cal, the majority of the non-Medi-Cal commercial market were Kaiser. Of course, as I say, in Contra Costa, Kaiser has 50 to 60,000 patients. The county has 260,000. So that's the Medi-Cal population countywide. I don't know the numbers for Sutter or John Muir out here.
And where's a burn center nearby? I remember when I
Yeah.
was born and they used to have a helicopter pad there, but where is it now?
I know that there's a the trauma hospital in the county is John Muir.
Okay.
I think it's either their Concord or Walnut Creek campus because you need a lot of volume for trauma. I'm gonna see if I can check. Um, I don't know where there's a burn center. I think I don't know. I do not. I'll have to. I know, that and that was a yeah, I'm looking here. Burn center. Um, well, I'm looking here. There's only I see it looks like only um 8 in the whole state.
Wow.
Um, yeah, I don't see one around here. Generally there are not many of them. The bigger one is having trauma hospitals. And you would go by helicopter to John Muir out in whether it's Concord or Walnut Creek. That's the county designates one trauma hospital which needs lots of volume, and so you would go by helicopter out there.
All right, anybody else have any questions? Joanna?
Yeah, I have a question for John. John, when you referred to the view ordinance and you said, something about looking at the Kensington, ordinance that exists already for the last 20 years, who is it that you said is looking at that? The Board of Supervisors or is that?
Our county planning department. They're
Oh.
looking at it with me because it's only in my district, and we're going to review looking at possible changes. I haven't heard what their proposed amendments are, and I think we can look at that, and we'll have an update with you once we start that process. And we did, as you know, a presentation last year, but we'll do more as we look at that.
Thank you.
All right. Okay. Is that all?
Lots going on right now, as you can see. We're impacted a lot from the federal cuts. Cities don't have the same impacts because they don't do health and social services like we do, other than San Francisco, which is a city and a county unique. But cities don't have the same impact that we're having. So it's significant. I think that's it going on. Oh, in terms of the county, just the Kensington and Pinole libraries are going to be temporarily closed for some renovations, which means folks will, it'll just put more demand on the El Cerrito and San Pablo libraries and El Sobrante. I mean, El Sobrante, San Pablo, El Cerrito remain. There is a ballot measure in June in El Cerrito for rebuilding the El Cerrito library. But Kensington and Pinole will undergo some improvements and be closed for a few months. Maybe one of them is a year, I think. That may be Pinole. But and then of course there's the Richmond libraries, which is a separate system. So that's happening. Yeah, that's what's going on.
All right, John. Well, thank you very much. I appreciate it. And we'll go on and
get off to some other things, and Ronnie will be there, and look forward to seeing you next time. Thanks.
All right.
And, contact our office if you have any questions regarding the grant program.
Okay.
Thank
Thank
you.
you.
Thanks.
Thank you.
Bye. Oh, and I guess, Bar, you said that the SNP bus is going to start, I think they've worked with Animal Services on trying to get a location where to store the bus.
Yeah, I haven't spoken with her, but I think it's gonna be starting soon.
Got
in the
it.
next months.
Yeah. Okay,
All right.
thanks. Bye.
We do not have our law enforcement agencies with us tonight. So let's hop over to Michelle, County Fire.
Hello, Chair Sargent. Can you hear me okay?
Yes.
Hi, Chair. Hi, Board. Hello, members of the public. So I have some redos from previous meetings just because there's been a lot of information at the end of the year and launching 2026. First, our new fire district website. So a refresh website was launched in December 2025 for providing easier navigation to information and tools for the public. In addition, the new website is fully compliant with all ADA regulations and requirements. So same great address, www.cccfpd.org. Next is Zone Zero update. The next state regulatory meeting on Zone Zero is scheduled, was anticipated for March. I'm hearing a further postponement to April of this year. So for now, I will attach homeowner resources into the chat and then keep you posted as that meeting is confirmed and more information is made available. As Supervisor Joya mentioned, Chief Burchard is planning to retire at the end of March. The CAO is leading that transition for open recruitment. And then finally, I've been getting some questions about electrical vehicle fires or EV fires. So with an increase of EV fires occurring throughout the district, we evaluated the specialized tools that we will need to assist us enhancing our operational equipment, not only providing firefighter safety and improved public safety, but emergency response capabilities. The consistent challenge that our firefighters face with EV fires is the inability to penetrate the sealed battery enclosure to extinguish that fire, right? I'm going to pop up a screen here to share. Can everybody see that okay?
Yes.
Great. So this is a cold cut Cobra system, and 2 cold cut Cobra systems are planned for purchase with a total cost of $200,000, and we will use them for a specialized EV and lithium ion battery suppression effort. It penetrates the sealed battery enclosure and delivers a very high pressure water mist. So think of your, high pressure water that you use, the hose at home. This is like 100 times that. The water also is combined with an abrasive aggregate that is delivered directly to the overheated or burning battery cells. So when a battery goes into what we call thermal runaway, there is no way to put it out immediately. This makes the ability of interrupting thermal runaway, reducing reignition risk, and limiting hazards for vapor release and water runoff more minimal. This capability is essential for safely managing our EV fires, battery energy storage system incidents, and other high energy lithium ion hazards that conventional host streams just cannot effectively control. So you'll see that firefighters are approaching that vehicle and there's some training as to where those battery units cells are located, and then the training, because of that high pressure hose, it literally cuts into what is perceived as a solid material and makes a tiny hole and delivers a high pressure water and aggregate to that battery, putting it out. So with that, thank you very much for allowing me to always share with you. And with that, I'll take questions.
Yeah, so Michelle, where are you going to store those 2 units?
That has yet to be determined. So Chief Burchard and the leadership will determine the locations that they will be stored and then accessible to the trained personnel. We talked about it at the fire commission meeting because the same question was posed by a fire commissioner. Having a trained individual, it'll be mounted basically in the back of a pickup truck. And so ease of transport rather than on, the large apparatus is much more agile, and the ability to respond is actually less time than it would be if it was on an apparatus. So there will be 2 locations chosen, maybe west, maybe central, east, really just focusing on getting the equipment, getting the training, getting the truck to transport the specialized tool to the location. It was estimated, I heard Chief Burchard mention, it's about 3 hours of water that is delivered to an EV fire currently. And so wherever it is in the county, that transport time of being, 30, 40 minutes from the location to the incident is much less than that 3 hours of water delivery. So it's an improvement. It's not ideal, but it's an improvement. And considering the cost of the tool, we want to make sure that we're needing it and utilizing it where it's necessary.
Sure.
Michelle, I have a question. Is
Yes,
this specifically for electric cars?
Battery.
It'll be
Car.
EV fires, battery engine storage systems. It's that high energy lithium ion hazard that we'll be addressing with this.
Do you think it's safe to park an electric car in your garage?
The mandates for EV purchases and storage are still being developed, and Chief Burchard actually spoke about, how the technology advances the equipment and regulations required about EV charging and storage. As a district, we suggest not having EV items, right down to scooters, stored in an enclosed space.
That's what you said at the presentation when they gave.
Yeah, that's what I thought. I'm looking at a new car and I have a garage underneath my car, underneath my house, one of the
Sure.
soft story style houses.
Sure.
And making me nervous to have an electric car.
Sure. We saw that, I think, in the Walnut Creek incident, where the Jeep was, and the company faced recalls like within days after the incident, but that parking structure was about 3 stories below ground and had ventilation and all of the things that a high-rise building would have, but the charging stations were down below ground. So this really prompted us to look at a specialized tool and training and things to better prepare us as a district to respond. And I think it speaks to our ability, even though a large organization, our ability to pivot to the needs of the community. Unfortunately, new technology is somewhat costly, but we, as you can see, we're really looking at ways to protect the community, whether it be above ground or below ground, really tending to where that risk is, and then putting training and tools in place to address it.
I wonder if eventually this could affect planning and zoning requirements for interior parking garages and interior parking garages for residential facilities.
It very well could.
Interesting.
Yeah, that affects the work you're doing with them. That affects you when you look at the properties.
All right. Anyone else have any questions?
Everybody else doing okay?
Michelle, thank you very much.
You're gold. It's good for me to hear that Bara is gold, because you are.
I think it
Anything,
may for you to have one of those over in West County somewhere off Interstate 80.
right,
I think
right.
be a location. And I guess time will tell. I'm sure you've got records on electric car fires, so we'll see.
Yes, we do
Yeah.
have data on fires, the type of fire, our response, its location, how long the crews were on site, or on scene. So yeah, we do have that data, and I know that we'll be looking at that.
Yeah. All right, Michelle, thank you very much.
Thank you.
Okay, we will go to item 6, subcommittee reports. Joanne?
We did not have any meetings since the last MAC meeting, and we have a meeting coming up next week, so there'll be another report in March.
Okay, thank you. All right, item 7, agenda items, speakers for upcoming meetings. Anyone have any feedback on that this meeting? Okay.
There is that new thing happening in El Cervantes, that new, what is it called? It's like a pay what you can cafe. And they're having different classes, and there's the interesting, there's a new yoga studio that opened up in El Cervantes. Maybe
So what would you suggest, like just inviting them to come tell us about their adventure?
Yeah.
Okay.
Yeah, that might be nice to, I don't know, does Joy's office hear about new businesses? Like, do you guys hear about that, Ronnie?
It
Or no?
depends.
Well, Melinda's on the El MAC, and she's the minister there. So of the new
Right,
cafe.
it's just an interesting business model.
Yeah, I haven't heard of it.
It's also, there's something kind of neat about hearing from other MACs what's happening in their community, so I can reach out to them if they wanna.
Okay. All right, the last item tonight is public comment on any item, but not on this agenda tonight. Laura.
So I wanna make a note here, Joanna put together all of these things happening in the area of different organizations. That's on the wall, so want to encourage folks who are listening to come see what's there. I'll take a picture maybe of it. I don't know where I can put it, but I'll take a
Send it to
picture.
Ronnie, maybe.
I'll send it to Ron, maybe you can post that someplace. Also, I'm really pleased that in December, Animal Services had a 98% live release rate of animals, which is pretty amazing, and it's really a shout out partially to Yamin. I don't remember his last name, but Yamin basically has been really diligent about talking to Animal Services about letting the rescue folks know about the animals that they're going to be killed. And so it went really from like 83, 88% to 98% in a month, which is remarkable. I don't know what it is for January yet, but the fact that December is a month where you often have a lot of animals that come in, it's really wonderful to know about. Also, the Wildcat Canyon bike trail, they have extended the time to write in for the EIR report. And they've had 2 different meetings to talk about it. I thought there was going to be more discussion. There really
I
wasn't.
got to the meeting right after you left. They said Barb was here, and there was nothing.
There was
San Pablo.
Oh yeah, I went to that.
Yeah.
But I went to the one-on-one also. So there hasn't really been a lot of discussion about it, and there's an organization that's come about called Friends of Wildcat Canyon. And so they're doing due diligence, and if anyone wants to get involved or know about them, there's some literature up there about it. So I think it's March 13th, EIR questions need to be submitted. There might have been some talk, I can't really speak too clearly about it, but that the Park Service has been talking about 6 other bike trails in other places. So if this one gets passed, It's like basically initiating like a domino.
Okay, set of precedents.
Yeah, I don't have a lot of information about that, but I think that's something to be concerned about. I don't know which parks, I don't know where. Do you know anything about it, Ronnie? 6 other, yeah, I find it a little peculiar that the parks are so independent from the communities. Like, it's super interesting that we don't really function collectively with them. So there's that, and then I'm trying to think if there's anything.
When we're the ones using the park. You know what I'm saying?
Yeah, yeah. So those are the things that I did get something today also. I don't know if Michelle is still on. Got something on my doorknob today from fire to talk about. I haven't looked at it closely, but how to protect my house so someone doesn't come by and put it on my door. So that's happening over by me in Hasford Heights. I don't know if it was.
That went out up here, I think it was October, wasn't it?
Yeah.
Yeah.
So we just got that.
Was it a door hanger or was it a letter?
It was a door hanger with like
Okay.
lots of printed items to
Perfect.
yeah.
That's outstanding. For those that receive letters, they're educational in intent. There will be a contact number at the bottom of the letter. You can reach out for additional inspection support from our inspector team, and that's free of charge right now. So if there's anybody thinking, oh, I got a letter in the mail and I'm in trouble, it's really meant for education purposes now, just to prepare people as we move forward. So
Yeah.
just outreach.
Michelle, I was asking you about that because I did get a letter, and one of the things on there didn't make sense, and I didn't want to bother anybody yet, but I'd probably like someone at some point to come by and point out to me where I have a tree that's overhanging something which I don't have.
Oh.
And I'm not making a big deal out of it. I thought it was very useful to see all the things that are required, but I had one thing on there that failed, and I don't know what he's talking about, so.
Feel free to follow up with me offline. You're never bothering me. I always welcome a call from you, Chair.
I could tell that because my neighbors got them too.
Mm-hmm.
So, they got pretty much the same thing. It's just there was one item on mine that didn't make sense to me where it said I failed on something.
Mm-hmm.
And also that you're not coming back to check until Halloween of next year. So, I'm not going to wait till then. I'd like to make sure my yard is safe. So, Liz, you got your hand up.
Yeah, I was curious just to follow up on what Bara was just talking about and the conversation with Michelle. So somebody left a door hanger on my door and they were also taking photos of my property, and I was wondering what was that related to?
Great. So typically there's two ways that we educate the community. There's passive information of door hangers and education. And then there's, I'm going to use the wrong word here, but targeted review of the property. And it's a education based, not enforcement based, but education based assessment of the property. It's not a formal inspection. Don't think that, we're fining or doing anything like that. It's about looking at the property from the street, from the public right of way, to assess what will make not only you, but your neighbors and your community safer in the defensible space perspective, home hardening and other things. If you have questions about receiving a letter, that you receive in the mail, not the door hanger. The door hanger is just information. It's just a way for us to reach out to the community to say, hey, we're here. And really the letter is too. Hey, we've been here, we've seen some things, here's some suggestions, and they are educational in nature as of now. There is a contact information. If you received a letter, there's contact information at the bottom of that letter. Please feel free to reach out. And if you need assistance, you can always reach out to me.
So are the photos meant to be included in the letter? That's why they were taking photos?
The photos are used for assessment purposes, proof that they were actually there. right?
Yeah, Liz, in my letter, they did put a picture of the front of my property and my neighbors on their letters, that it was on that too. So maybe they're gonna follow up with a letter to you guys.
Right.
Okay.
Michelle, pretty effective distribution chain you got there. Who are you having do that?
Those are our ever hardworking inspectors. The inspector teams are out, and again, an extension of our educational effort and outreach ahead of new and upcoming regulations, but also our planned work, right? Having that outreach is essential ahead of any funding proposals that we look at. We are aware of the Bay Repair Grant, and we're considering the best path forward for those things.
Do they moonlight?
No, you can't have them. They're all ours.
See if they-
No,
How's it?
I'm glad that they're in the community, and I'm glad that they're performing outreach. I know it can feel like, oh, a badged member is in front of my house and they're taking pictures. It's really about what to do to make our communities safer. It is not from an enforcement perspective right now.
All right, any else have anything? Joanna?
Joanna's gonna be the first person
We're gonna use a podium.
Yeah, I'm the first person to use the podium. That's exciting. Look at
picture.
Good evening, Mac. I'd like to make public comment on two items. Last night's fundraiser that was held here is for the Greater Richmond Interfaith Project, which has been around for decades. It's a collaborative project of faith communities in West County who raise money, provide volunteers for a shelter that's downtown Richmond. That's the only shelter in West County that houses families in need of housing. And they've got quite an extensive program. When we ran Freedom School, we worked collaboratively with their social worker. They have a social worker for children, and lots of great programs there, including serving lunch every day. And Open Door goes down and serves lunch there on the third Thursdays, I think it is. Secondly, I'd like to invite you to come back here to this building on Sunday, March 15th. I will be giving a talk on Sunday morning as part of this morning service about my experience volunteering in the Eaton Fire, after the Eaton Fire, at the Wildlife Resource Hub in downtown Pasadena, and basically had contact with about 200 to 300 fire survivors. An experience that it basically took me over a year, really, to get what that meant for me. It was a very serious experience and has given me a whole new appreciation of Zone Zero and all the work that Michelle's group does, or Michelle's agency does, and how important it is to not become a fire victim. What time?
March 15th.
Sunday, March 15th. The service,
Upstairs.
yes, the service starts at 10 o'clock. And I'll be in the sermon slot, which is usually, a little later in the hour. So probably closer to 10:30. You're welcome to come.
Will it be taped?
Yes, we have a Facebook broadcast, whatever you call it.
Live.
And so it would be, you could tune in and see it on Facebook. And my intention is to provide also as part of what I say, some probably stuff like that, but I had very specific experiences with what people do who are there to help, how people can help. Okay.
How long will it be, 1 hour?
Well, the service is 1 hour, so my talk's just gonna be like 15 minutes.
Okay.
And just as a little parenthetical illustration, apparently at a point in the past, in the 50 years that the church has been here, there was a community-wide game plan for fire and disaster earthquake response. And Pat Yamamoto, who used to live right down here, I've been a member here since the mid-50s, said that there were various designations of where things would happen in the neighborhood in the event that we became a disaster site. And apparently Open Door would be the morgue. In that plan, this building was set aside as a place where they would take the dead bodies.
Oh.
Yeah. So, I mean, there's some serious stuff that you gotta think about. You know, and reasons why you don't want to become fire victims. So it was that, but when she told me that, that really brought it home for me. I'm like, whoa.
That's not another place for us to sleep.
How did you get involved with the organization? Did the church get involved?
The church has, the church has a group and has had it for over 100 years called United Methodist Committee on Relief. It's a global organization, and so March each year is a time when churches can, if they want to, focus on UMCOR is what it's called, and talk about the work of UMCOR. So this is a very drilled down specific project that UMCOR had. I got trained maybe 2 years before that to become an UMCOR volunteer in my retirement. And I just never thought, like, they'd say, oh, there's a flood in Paro, or there's a fire in Paradise, or you know. And I just never felt called, but once it happened to LA, which is where my mother grew up, I felt like I have got to go. And I was able to take public transit down there. And it's because it was, you know, it's an urban fire, so it was easy for a volunteer who prefers not to drive to get there, so. Yeah.
Okay.
They're more on the 15th. Thank
All
you.
right, thank you, Joanne. Okay, anybody else? Oh, yes, Michelle? Liz, you're up too. Michelle, let's go with you first.
Thank you. If Joanne could share the virtual link or information, any presentation materials, I would love to support that effort.
Okay, and Liz, you took your hand down. Anybody else have anything? So, motion to adjourn, somebody?
Motion to adjourn.
Second.
Okay,
That was quick.
all right. I know all those are in favor, so
Hi.
we will adjourn and see you all next month.
Wow.
Thank you, Ronnie. You made it work.
Oh, thank you.
Nice jacket.
Oh, thanks.
Thanks, Greg.
I've been involved with